leaders. I'm pleased to introduce our first speaker for our first session today, Joseph Emmanuel Amuah, who is grateful to live on the ancestral lands of the Algonquin Nation, otherwise known as Ottawa. Born in Ghana, he is currently the Manager of Indigenous Health at the Canadian Institute for Health Information. He leads teams to co-develop alongside First Nations, Inuit, and Métis partners contextually relevant health information products in alignment with their health and wellness data priorities. Joseph, over to you.
All right. Thank you. And good morning, everyone from Ottawa, the unceded unceded territory of the Algonquin Nation. As Kendra said, my name is Joseph Amuah, and I'm currently the Manager for Indigenous Health at CIHI. And I would like to apologize that my director, Garina Hawe Makomba, is not able to join us as originally planned. So I'll be holding the fort for both of us. So I will try and share my screen. But thank you very much for inviting us. So let me see here. Okay, share. And let me now go to the deck and also share. Okay. Please let me know if I'm sure, can you all see my screen? Just maybe a voice, because sometimes I may not see everyone.
Yes, we can.
Okay, thank you. Thank you very much. So I've already introduced myself briefly, so maybe I would just dive into our land acknowledgement. So as I'm calling in from Ottawa, I wanted to do a land acknowledgement as our head office is also located here. So we at CIHI acknowledge that we are guests on the ancestral lands of the Anishinaabe Algonquin Nation, where Ottawa, Rideau, and Gatineau rivers meet. The Algonquin and Anishinaabe have been caretakers of these lands since time immemorial and continue to be today. We recognize our privilege and commit to the work of truth and reconciliation so that we can co-create trusting, long-standing relationships with all First Nations, Inuit, and Métis peoples, communities, organizations, and nations from coast to coast to coast. And our intention is to help create accountable health systems in relationship with First Nations, Inuit, and Métis peoples that include everyone and takes care of everyone. So with that, I'll move on to maybe tell you just a little bit about CIHI, in case you've not heard of us. So we are an independent, not-for-profit organization that collects, analyzes, and distributes comparable and actionable health information about Canada's health systems and the Canadian population. We're established by the federal, provincial, and territorial governments a little over 30 years ago to provide data that informs health policies and supports health service delivery and helps to improve health outcomes across the country. So back to maybe why I'm here, and thank you once again for inviting us. I would like to share a bit about our Indigenous Identifiable Data Policy, and then what we consider to be partnership-based analytics reporting that we do in partnership with First Nations, Inuit and Métis organizations, and talk about a bit of some work we are doing on the National Data Governance Framework, and then speak to a First Nations reference guide to accessing data that was actually released just yesterday with the guidance of a First Nations Listening Circle. So to our Indigenous Identifiable Data Policy. So one basic approach to respecting First Nations, Inuit and Métis data sovereignty is to ensure that we, CIHI as an organization, whenever we are able to identify First Nations, Inuit and Métis people or communities in our data, do not share that kind of data without the appropriate authorization. And so back in 2020, we implemented a First Nations Inuit and Métis identifiable data policy that requires data requesters, such as researchers, to provide authorization before requests can be granted. We want to be absolutely aligned with First Nations Inuit and Métis data sovereignty principles. And so on this learning journey, that is one of our first steps. And we also want to ensure that if data about a community is being released, the leadership of that community is aware and are in agreement with release of that data to the third party or the researcher or the organization that is making that request. So that is essentially a summary of what this policy seeks to do and how the implementation is being operationalized right now. With that policy in place, the next step for us has been to look to partnerships where we can bring our analytics expertise and the data systems that we have about communities to them. And so you will see on here, we have a few pictures of some of our partnerships and relationships. Most of our analytics that align with First Nations, Inuit, and Métis health data priorities are driven by these partnerships and relationships. And some are formal through MOUs, and some are informal through data requests. Sometimes we are at conferences and we meet people who talk to us about, data about their communities, and if there's opportunity, they are able to obtain the requisite authorization. We are able to then provide the data or do the analytics to support them. So this is a first example that I wanted to highlight in terms of our partnership-based analytics. So one of our key partners is Sioux Lookout First Nations Health Authority. And we've been collaborating with them for over 10 years. We started, our relationship, and at the time they had some analytical capacity and they wanted to access data in a secure environment. And so we're able to provide secure access to some data for them to actually analyze themselves and pull some information that they needed to support their projects. But we've since been able to establish an MOU more formally just over a year ago. And now, because they have the mandate of, I think, about 33 First Nations communities that they serve, we are able to share analytic reports with them. We're able to do analytic services focused on those communities and share with them. The link in the deck, I believe, will be circulated, or if not already circulated, can lead to a most recent project we undertook with them, where they actually have now published their report publicly on their cancer profile for the communities that they serve. And then there are two others. Back in August 2024, we did some analytics to support them on health resource utilization. And then a few months ago, we submitted a report to them on maternal and newborn health. And I will try and speak to that next. So I wanted to highlight this one recent example, mainly because of, it's new, it's quite fresh, and it's also a testament to how strong partnerships and respect for Indigenous data sovereignty can yield very good results for our partners and First Nations Inuit and Métis communities. As I mentioned, they serve 33 First Nations in Northwestern Ontario, and we've had a relationship with them for more than 10 years. And they did an evaluation of maternal and newborn health services and identified the need for strengthening community-led maternal care, including strengthening midwifery services and doula services. So an example that we're made aware of was that they routinely evacuate mothers to give birth in larger cities. And this does not only disrupt family connection, it does also impact, loss of community support, culturally grounded practices, and access to elders or knowledge keepers. And so they decided to delve more into the outcomes associated with maternal and newborn care to support planning and decision making to strengthen maternal and newborn care, newborn services across these 33 First Nations. They wanted to combine the health data that we have and First Nation community knowledge to explain those outcomes and guide culturally safe, culturally relevant, contextually appropriate, and community-led maternal and newborn services. So that was why they connected with us. And what we then did was we had a series of meetings, virtual meetings. We had about 3 virtual meetings with email exchanges in between just to clarify and confirm their request. And these then evolved into a formal data request spanning 11 fiscal years of data. They also identified 18 different measures and indicators that were of interest. And then our CIHI analytics teams then prepared a report of the results of these 18 indicators and measures, some of which included, as you can see, obstetric trauma, maternal gestational age at delivery, and large and small for gestational age rates, etc. So with that, we're able to deliver on their request. This is a second example, our partnership with First Nations of Quebec and Labrador Health and Social Services Commission. And with this, we have a formal memorandum of collaboration with them that have been in place for more than 4 years. What they typically we typically do is, there are requests for again analytical support around indicators and measures at the community level. And once they receive these reports, they actually are able to provide indicator results for each of the communities for which we're able to provide reporting for through their own secure portal, which they were able to engage with their communities to access their own data that way. Okay, so since our relationship, we've been able to deliver on these reports that you see on the screen. So back from April 2020 through to May just this year, and we are working on some ad hoc reports right now as we engage. So there's quite a bit of work, and I will just highlight the most recent or maybe the regular updates that we do with them. And as I mentioned, the reporting covers individual nations with age and gender breakdowns as needed, and they usually are indicators that are standardized to Quebec population or the Canadian population, depending on how they would like the indicators to be calculated. And we also provide comparable data at the Canada level, at the Quebec province level, and specific health regions that is specified that we provide results for to enable them compare community results to higher level results, higher level in terms of the sort of geographical area. And as I mentioned before, communities have access to their own individual community results. So it is quite transparent, and they also know communities know exactly what the FNQLHSCC is also receiving and using to support planning and decision making. Next, I want to maybe briefly talk about our Indigenous Data Governance Framework and national framework that we've been working on to help support health systems in how they approach respect for Indigenous data sovereignty. So this is work that we've been doing with the Anish Nagegi team at the Children's Hospital of Eastern Ontario Research Institute, and it is to help CIHI develop a national data governance framework that ensures that in our work with health system partners in health information, health analytics, we are able to support them to also engage respectfully with First Nations, Inuit and Métis data that may be in their possession, and then establish the requisite mechanisms to engage with communities, etc., to make sure that they have authorization, and also they have processes in place to be able to share that data with communities that need the data. So they first did a scoping review of how Indigenous data sovereignty principles are generally applied in research, then identified some wise practices that are highlighted in literature, and also great literature around how to do this in a good way. And through that, they also developed a tool to support and measure the implementation of Indigenous data sovereignty principles in research, so that they can sort of evaluate and get a sense, or we can evaluate and get a sense of how well we are adhering to these Indigenous data sovereignty principles. And further engagement is planned on the framework itself. More extensive engagement is planned this year, because we just received the draft one, and therefore even for the draft one there was a fair bit of engagement around that with Indigenous data sovereignty leaders. But for us, it's really about respecting Indigenous data sovereignty, and so having some governance framework in place to support our health system partners to be mindful of these, and really it's really as a first step in the process. Finally, I have this reference guide that was actually released just yesterday, that our relationship with the First Nations Listening Circle helped us to develop. So as we as an organization learn and evolve in our understanding of First Nations, Inuit and Métis data sovereignty, we recognize that data sovereignty is best respected when data is repatriated back to First Nations, Inuit and Métis communities. And in order to be able to do this effectively, First Nations, Inuit and Métis communities will have to know how to access their data that reside with organizations like CIHI and many other organizations. So over the last year, we collaborated with the First Nations Listening Circle to guide CIHI on developing a reference guide that can be used to tell the story of how to access First Nations Inuit and Métis health data currently held at CIHI. This, process of developing the reference guide was grounded in ceremony. The circle had an elder who attended all the meetings, and they explored, like the key for the reference guide was to explore the challenges of accessing data about First Nation communities held at CIHI, you know, how they envision, framing of existing CIHI resources so that it supports First Nations knowledge systems, self-determination, and community use. And finally, to come up with a tool that makes it safe and easy for First Nations, Inuit and Métis, for this particular group, First Nations communities to access health analytics about them from CIHI. So this is the sort of the guide they developed. They came up with this process highlighted by the evolution of a strawberry plant. And as you can see from the diagram, there are 6 steps that they developed. And the first step or stage is when a community and CIHI engage and learn together about what the community may be interested in and what CIHI may have. The community may then invite CIHI to share what we do with some real examples, after which the community may approach CIHI with their story and their priorities. Then the community, together with CIHI, discovers, what CIHI is able to offer in our conversations to support their health and wellness data priorities. And then the community will then make a decision whether to move forward with a data request or move forward with CIHI's resources to be able to support them with analytics. And we'll follow up. CIHI is supposed to follow up according to reference guide. We should follow up with the community then in about a month or 2 later, or other communities choosing in terms of time, because we know that communities have a lot of priorities and other pressures, and so we have to be patient in connecting back to them. So we are currently working towards developing something similar for Inuit and Métis as well. So with that, I'll shift to CAN ODT and talk a little bit more about that. So given that organ donation and transplantation is the focus of this virtual forum, we wanted to share a brief update on the CAN ODT project. If you may recall, it's a multi-year initiative to modernize organ donation and transplantation data and reporting, funded by Health Canada and co-led by CIHI and Canada Health Infoway. CAN ODT is CIHI's newest data holding and began receiving data in 2025 with 7 provinces submitting new digital data this spring. The aim is to capture information across the full patient journey using modernized data management approaches, and it will replace the organ donation and transplantation data flow to CIHI's legacy data holding, the Canadian Organ Replacement Register. Now, how will this benefit patients, families, and donors? Well, CAN ODT will support timely and comprehensive pan-Canadian reporting for comparisons and quality improvement initiatives to improve patient and donor care, and will support research as well. The CAN ODT minimum data set data dictionaries are shown here. We have developed new national data standards and priority health performance indicators with extensive input from the ODT community, including patients, families, and donors. Included in these new data standards to capture distinctions based Indigenous identifiers as well, unlike the core system. So now we'll be able to identify First Nations, Inuit and Métis. And these data elements are captured in all three MDs shown on screen and are available using the QR codes on there as well, or going to cihi.ca/ODT. These data standards are foundations to create the opportunity for CIHI and communities to collaborate on new projects for Indigenous perspectives. We are also pleased to share that CIHI is collaborating with Dr. Caroline Tate and her research team to identify opportunities to leverage CIHI data using the core data for now as we await new digital data flows that will come through the CAN ODT, where we have even distinctions-based data and makes the research more focused as needed. Next steps for the coming months is that we'll continue discussions on how we can leverage CIHI data in ways that support and enhance understanding of Indigenous people's experiences with organ donation and transplantation. We'll also identify opportunities to share our learnings with the broader community. And we would like to extend, a special thank you to Dr. Tate for her unwavering commitment and efforts and her contributions to CAN ODT advisory groups over the years. So thank you to the CDTRP for your role in bringing us together at this forum. Now, I want to maybe just wrap up the presentation. That also to say CIHI is on a learning journey, and we are not there yet, but we are working hard on that journey to co-create approaches to respectfully work with First Nations, Inuit and Métis communities on their data. And we are learning from partners and growing relationships with First Nations, Inuit and Métis organizations and communities on their own terms. We've established internal processes to ensure that we are respecting First Nations, Inuit and Métis data sovereignty principles, and our partnerships with First Nations, Inuit and Métis have enabled us to repatriate data about them to them, and we will continue to learn and grow in doing this and ensure that we are doing better and better in how we honor the health and wellness data priorities of our partners. So with that, I'll take a pause for questions. Thank you. And with that, I'll also stop sharing my screen. So maybe over to you, Kendra.
Thank you so much, Joseph. That was a great presentation. And it's really great to see what CIHI is working on and doing within this field. Now, I don't see any questions in the chat, but I invite anybody to put their hand up or to unmute and share any questions at all. If not, I can get us started. Okay, I'll get us started. So historically, health data has often been collected from Indigenous people without clear benefits flowing back to the communities. So what lessons has CIHI learned about building trust and ensuring that data are used in ways that support community priorities, self-determination, and wellness?
So I think in the last few years since we started, establishing like stronger relationships, the approach has been to go to communities or be in community in the sense that we are present at First Nations, Inuit and Métis conferences and programs where that's where the conversations start usually, because many organizations don't know about CIHI. And so when we are at these events and forums, we introduce the organization and let community members know and organizations know the resources that are available when it comes to First Nations, Inuit and Métis data and analytics. And through that, we continue the conversation again at at their own pace. What we've learned is that as long as it's at their own pace, it's easier to build a trust, and it's also faster to actually build a partnership in the long run. And so it's we wait, we have the conversations, and we wait for communities until they are ready to engage, and then we follow up. And also, one of the other lessons we have learned is to, in talking about the data, just try to understand better the priorities of communities and not necessarily suggest our indicators or our measures, because there are many situations where we've come up with new measures focused on communities because that is what is of priority to them. And so that is how we've approached it.
Yeah, thank you so much. It's nice to hear that some lessons are being learned along the way as well. Um, Still not seeing any. So on more of a practical level, do you have any, practical tips or steps that you think that researchers and other organizations can take when it comes to the lessons that you learned and data when it comes to the sovereignty principles?
Yeah, so I think the first tip is, if there is interest in working with First Nations Inuit or Métis data, I think the first step is to connect with the communities that the data is to be, collected about, or to be the analytics is supposed to be done about, and engage with them and make sure that, they your research objectives are really aligned with their own priorities as well. And if not, you may have to pivot to align with what the communities require. And then with that in place, you can then obtain authorization from them. Because, for example, as an organization like CIHI, our approach is that we don't share that data with anyone without authorization from the communities. And so once you are able to have a conversation with communities and build that relationship, and ensure that your objectives are exactly what they also require, or you are aligned with their objectives and approach to doing the analytics, then you can obtain the permissions and authorizations. And then from there on, you can then sort of start research or access the data following that. So that will be my tip: is first engage with the communities and ensure that there's alignment in terms of priorities, and then use that to obtain their permission before engaging with the data sources.
Perfect. Thank you. Give people some time as well. Still. I'm seeing that you added the guide into the chat there. Thank you for that.
No.
All right, so we've talked a little bit lessons learned and some kind of practical tips. What do you think is still needed, or what changes do you think are still needed when it comes to these partnerships and managing health data?
So I think that one of the things that in general health data challenges we have right now is First Nations Inuit and Métis identification, having the distinctions based identifiers in our data systems. So right now, like for example, as CanODT is one of the pioneers in introducing that into CIHI data holdings, because most of our other data holdings do not have this. And but we also understand that kind of data, collecting that kind of data requires strong data governance mechanisms in agreement with First Nations, Inuit and Métis partners and communities. And so those kinds of conversations are necessary in order to be able to collect the data. But at the same time, I think those conversations have to continue. The trust has to be built over time, and again, these trust conversations cannot be rushed for many historical and reasons that you know not good. And so we have to make sure that these conversations are happening at the speed at the speed of trust, if you will, and be able to then um, have mechanisms in place to be able to identify First Nations, Inuit and Métis in the data, to be able to enhance specificity of research, and also be able to ensure that different communities are benefiting on their own terms, and not sort of the pan-Indigenous approach, which does not always help to ensure that all communities are receiving the resources that they require to be able to make decisions or plan for health services.
Yeah, absolutely. All right. See if we have any in the chat. All right, I am seeing a question. So, what are the generational impacts or consequences of historical misuses or mismanagement of data in Indigenous patients, which inform how we can collect data today?
Okay, so I think that when it comes to generational impact or consequence of historical misuse, I mean, we know that there's been a lot of harms to historically to First Nations, Inuit and Métis communities, where data has been extracted from the communities and ended up being used against them or to harm them, or never to return. So researchers have gone to communities to collect data, gone away and just, did their publications and never gone back to the communities to let them know about even the outcome of the research and how it could be used for decision making or to support resource mobilization, etc., for those communities. And so all of that definitely created mistrust over the years, and rightfully so, because if in the past you've used the information or the data to harm my community, I don't think it will be that, it is completely justifiable to prevent you from collecting data in the future without having a thorough conversation about how that data will benefit our community. So that informs the steps we have to take to make sure we build a relationship, establish the trust, and make sure that communities are comfortable and are also interested, or they are actually the ones driving the research objectives, especially if it's about them. If they are the ones driving the research objectives, then definitely once you're able to do that research, you can return or do that research actually with them, alongside them, work with them in partnership to actually get it done. And then they can then use that information to support their own planning and decision making, and obtain understanding about the services that they receive, etc. Especially also if you work with community closely that way, then they also bring on board the community knowledge and the indigenous knowledge, and their traditional practices, like all the cultural elements, ways of being, and ways of knowing, all of that incorporated, provide a fulsome picture of what is actually going on, rather than taking the data away and just focusing on a narrow, potentially what may be considered to be scientific, but definitely not the complete worldview of the communities that you're trying to work with. So
Hmm. Thank you so much for that response. Another question in the chat, just they might have missed it in the talk, but how will the principles in CIHI's new guide for First Nation communities be applied within CAN ODT?
yeah, so it's it's very similar to how all the other data systems we currently do it. There may be opportunity for communities or groups of communities to approach CIHI around, understanding, say, organ replacement profiles for their communities or donation profiles or similar, health services outcomes of donors or health outcomes of recipients or transplant recipients to understand those. And so it's the same idea. If we are approached, we'll have the conversation about what is available, and then we'll move from there. So the CAN ODT system accessing that data will not be any different from accessing data about First Nations, Inuit and Métis in any of our other CIHI data systems. So the principle is global, I would say, to all the data systems that CIHI currently holds.
Thank you. All right. So I guess we can wrap up then. So I want to thank you so much, Joseph, for your presentation and for sharing your expertise and perspectives with us today. Your discussion highlighted advancing Indigenous health equity and how it requires more than collecting better data. It requires building respectful relationships, recognizing Indigenous rights to self-determination, and supporting Indigenous leadership in how data are governed, interpreted, and used. It was a phenomenal presentation, and I look forward to seeing how this turns out in CIHI. So thank you so much.